Welcome back to Let's Just Do This. I'm Todd Miller along with Margaret Wallace Duffy, back for our second season on Kojiko, and today we're talking about vision therapy.
We are, and we're always so excited to have both returning guests as well as new guests come to the table here at Let's Just Do This to help educate and empower and inspire you to live well. And today, vision therapy is a topic, and I have to tell you, it has been a game changer with many of my patients, and I've learned so much from the person sitting across from me. Dr. Carolyn Teskey from Eyes Focused on You has been in practice for over 24 years and is always looking for new ways to help her patients. And we're also thrilled to have Dr. Shirley Hall, who is also an optometrist and a neurodevelopmental optometrist. She is actually, I'm going to read a little bit of her bio as it is very impressive and something it's important for us to know. She's a board certified fellow in developmental vision and vision therapy by the College of Optometrists in Vision Development. She is also on the advisory board member of the Neuro-Optometric Rehabilitation Association. And you just got back from Hong Kong.
Yes, I did.
Speaking to a team of physio and occupational therapists about vision therapy. So are we ever lucky to have this caliber of guests on our show? Welcome.
Thank you. Thank you for the opportunity.
Well, I think it would be great to start off with you, seeing as you literally are just off the plane. from
jet lag.
Indeed. One of your passions, both as a primary care optometrist, but now really focusing on vision therapy. For the average person sitting at home, what is vision therapy?
Vision therapy is where we apply activities and changing the person's visual process because they have adapted incorrectly. And sometimes it can affect how they view the world. And we want to make sure that they are seeing things the correct way, you might want to say.
Right.
And it can affect a person's ability to learn, as in children. And sometimes when a patient has a brain injury, it can actually cause them to have visual symptoms. And with vision therapy and rehabilitation, we can actually get them back on track. And symptoms such as blurry vision, double vision, and sometimes even headaches that you think might be just something else, it can actually be visual related.
Interesting.
Yeah.
Now, I know, Dr. Teskey, we've talked about vision therapy before in the show, but I love having both of you here to really explore this topic a little bit further. When you're, as a parent, there was a stat that Dr. Haw shared that really made my jaw drop with respect to children that are having difficulties in literacy issues or troubles in school and the connection to visual problems. Can you speak to that?
Absolutely. So thank you for having me again. It's always a pleasure. And today is really an honor. So Shirley and I probably graduated similar era, but she certainly brings a wealth of experience, which I admire, and am so proud to sit beside her today. Learning, 80% of what we learn is visual. And I think we discount the importance of the visual system until we see a problem. And I believe the statistic that is what you shared, 60% of patients who have a literacy problem actually have a vision problem.
Wow.
So it's really important that we start off our learning well, knowing that the visual system is appropriate.
And I think you said something earlier before we went on air, and that is a lot of these kids that are being undiagnosed are attributed with other illnesses or challenges that aren't correct, and it actually comes back to the eyes.
Absolutely. Learning deficiencies are often mislabeled for patients when really it's a vision processing problem. Mm-hmm. It makes so much sense that as a child you would be distracted and have difficulty focusing when your vision is not cooperating and you're not getting the right input to the brain.
Right. Now, how does lazy eye play into this when it comes to vision therapy?
Well, lazy eye, or amblyopia, they call it technically, is really a maladaptation. It's how the brain actually adapted. And it can be from an eye turn, or it can be a big difference between the two eyes when there is a focusing problem. And so what the brain does, it always likes the path of least resistance, right? So
Right.
It will find the most efficient way. So in order to avoid seeing double, it will actually turn the eye. And sometimes the brain will shut off the one eye And that can cause the one eye to be the bossy one, and then the other one not to be as bossy. Or it might just try to keep things single, but it tries to blur one eye just to avoid it as well. And so there's two types of lazy eyes. And for us, what we try to do, we try to make sure that the brain work together as a team, that the two eyeballs are the only two parts of the brain that move. And we want to make sure that we eliminate any competitive rivalry between the two eyes and make sure that they team together and work together as a joint partner, as they should.
So it sounds like there's a stronger eye that's trying to take over most of the processing and
Yeah.
relaying the information, and the other one, you said it just almost shuts it off.
Yes, and exactly. Sometimes it's not the lazy eye that's the problem, it's actually the bossy eye. You just have to tell the bossy eye to back off and let the other eye come out and play. Let's put it that way.
So, you know, as a therapist myself, as a massage therapist or any therapy, we think of it being very hands-on. I really want to get across to all of our listeners and viewers, when we talk about vision therapy, you actually do things physically in a vision therapy session to retrain the brain, correct?
Absolutely.
Can we talk a little bit about that? Because I really don't think people understand or what they can expect if they're going to go see a vision therapist.
Absolutely. With vision therapy, it's not just the eyes. We want to make sure it's a whole body experience. It's eye, mind, and body. And basically what we try to do, we try to throw visual challenges at you so that you can explore the environment that you're in and to make sure that you can actually handle the challenges and to solve them appropriately. And basically we want to know, do you know where you are? And do you know where the object that you're looking at, where is that? And also, what is it that you're looking at? And how did you acquire that information? What visual skills did you use? And are they efficient enough to acquire the information that you need to get? And once you've acquired it, what are you going to do with it? How did you interpret the information? How did you process it? And what is the outcome? And the motor outcome would be speech, would be writing, would be the motor output.
Right.
And so that's why vision therapy is not just for someone with any deficits, it's also for our athletes. Athletes already have, you would think, excellent visual skills, but you know what? They might just want that little edge, and they can actually still, everyone can improve. And vision therapy is for anybody, and age is not a limitation at all.